Nairobi, Kenya's capital city, one of the 47 counties with a population of about 5 million, comprising 49% males and 51% females. Children below 15 years constitute 34% of the population, while youth aged 15 to 24 years constitute 18% of the population, according to the 2015 Kenya National Bureau of Statistics population projections. With such a diverse populace, the county health sector is answering to the many needs in both infectious and non-infectious diseases. By the end of 2018, Nairobi City County had over 190,000 residents living with HIV, out of which 8,137 were children of less than 14 years of age.
For the population of over 4 million, we need to identify these patients. So we do testing and counseling in our health facilities, and also we give outpatients outreach services at community level.
In close collaboration with Population Services Kenya, the county is scaling up HIV testing and counseling through HIV self-testing. HIV self-testing has a potential to contribute to universal knowledge of HIV status. Its appeal lies in that it offers people who are currently not reached with existing HIV testing services an opportunity to test themselves discreetly and conveniently.
We are distributing this test kit in over 20 pharmacies within the city, and now we've brought it into 10 facilities as pilot facilities in the county.
Just as recent as December 2015, the county organized a 10-day testing campaign targeting key populations and provided those who tested HIV positive with linkages to care and treatment services within relevant health facilities. A total of 6,602 people were tested, surpassing the set target of 2,000. With that came an increase in ART initiation among TB and HIV co-infected patients. To date, all sub-counties have introduced isoniazid preventive therapy (IPT), and more than 300 healthcare workers have been trained on the administration of it. In 2017, the county had a total of 6,000 patients on IPT.
We give isoniazid for a period of 6 months to prevent them from getting TB. However, we also do active case finding and screening within our CCC of all people living with HIV, so we can identify early anybody who's showing symptoms of TB, and we're able to do a test, either Gene Expert or TB Lam, and be able to find out if someone is suffering from TB.
I can learn a sputum within 2 hours. That will make us learn so many samples within a day, and that translates to greater numbers of clients getting treatment.
Hata kujikisikilia kwa pikipiki nikiletwa hapa, nilikuwa ninasindwa upande, na leo hata choka ninachukua, ninapazua kuni, ninafanya kazi.
Riding on the fact that no baby should be infected with HIV at birth, Nairobi County, with support from UNAIDS, is scaling up prevention of mother-to-child transmission services. The county is following closely on the national HIV targets, that is, 0 HIV infections at birth for all babies.
Nilipojua hali yangu, nikakuja hapa, na walipojua ujauzito wangu, waliniambia uko tu sawa, but tutaku advice venye utaishi na venye utalinda mtoto wako na venye utatumia madawa yako kwa usalama, ndio ujilinde vizuri na pia mtoto wako.
Between December of 2015 to end of 2017, over 10,000 pregnant women were covered by PMTCT services, yielding to 97% PMTCT coverage.
We have registered 162 moms in our PMTCT clinic. The ones that we are still having, all the babies have registered a negative outcome. That means that of all the moms whom we have been working along with, none of the babies have turned out positive.
Integrating HIV interventions with maternal and child health services is an efficient strategy in a county where HIV prevalence is high. To this end, not only does primary prevention of HIV improve, but maternal mortality is reduced and the health outcomes for HIV-exposed and HIV-infected children gets better as well.
We test them, and for those who are positive, we're able to give them the treatment that they require, and we monitor them even as they get the immunizations.
The Nairobi County partnered with PS Kenya under the immunization campaign dubbed Kutomaliza Chanjo ni Kukatiza Ndoto. The concept is based on aspirations and dreams caregivers have for their children, and using this as an emotional hook for increasing immunization uptake, e.g. continuous polio vaccination.
Immunization is a great achievement in our county. We have over 640 immunizing health facilities, and we partner with the public and private hospitals.
Everything happens within the MCH department. That when the mother comes, she will get the immunization services. The mother will get growth monitoring services for the baby. The mother will get the pharmacy services for her and the baby because the refills are being done here. And the mother will get family planning services all under one roof.
Tunapatiwa dawa at free of charge. Kama tuko na any problem ama kama akona shida, she's checked from here.
In the year 2016, we started a simple method of caring preterm babies, kangaroo mother care, whereby those babies are taken care of by the parents. The mother is expected to put the baby in the chest.
Mimi nilizaa watoto wawili. Walikuwa 1.2, 1.4. Na waka reduce mpaka 900 grams. Sasa vile nilijua hii kangaroo, nikaanza kuwabeba. Walianza kuongeza. Niliwabeba mpaka wenyewe wakakataa. Na walikataa vile walifikisha 2.5 and above.
The Ngara Mat Clinic opened on January 31st, 2017 and enrolled 77 clients in the first 3 months. The clinic offers methadone and services for other medical conditions including NCDs and STIs, as well as referrals to other services as needed.
It works the same as the heroin, but it has lesser withdrawal effects, and it acts longer in the body, so they can have a normal life.
Tangu nianze methadone, nimeona tofauti sana. Jo wakati huo ukiniona nikitumia drugs na saa hii unaona tofauti. Jo nimechange.
After tumetumia methadone sasa for 10 years, life imebadilika tena. Kwa sababu nimerudisha boma, madam amerudi, nimeset biashara tena, na uhusiano yangu na family members imerudi.
There are 9.2 million adolescents and young people aged 15 to 24 years in Kenya. This is close to 20% of Kenya's total population. This is a key demography whose health status directly affects the socioeconomic status of the country. More than 75,000 adolescents aged 10 to 19 years and youth between 20 to 24 years in Nairobi have been reached with information and counseling on HIV, sexual reproductive health and awareness on gender-based violence through the one-to-one integrated digital platform OIDP with components of web and mobile-based features.
In this application, you can book an appointment with the health provider, you can book an appointment with the peer counselor, a fellow student, or also book an appointment with a lecturer if need be.
What we are doing is creating awareness to the youth that there is HIV and HIV is real. How we can prevent HIV from spreading.
We started by training these dream girls to become peer mentors, so that we were saying once we train them to be peer mentors and then we place them in our facilities, then the adolescent and young person who is coming in this facility will be able to easily identify with this peer mentor, and then they are able to have a discussion.
Since we've kept the mentors in the health facilities, the numbers of the youths are now increasing for them to attend the health facility, and we are seeing that as a kudos on our side, and it is also good for the youths themselves.
The county government of Nairobi rolled out a program that will see an upgrade of its health facilities and establishment of new and specialized units in the existing county hospitals. Renal dialysis unit and methadone-assisted therapy for intravenous drug addicts at the Mbagathi Hospital are among the projects the county is currently undertaking to revamp its health sector.
Ninaendelea kuoshwa, nasikia tu niko mzuri. Yaani hata saa hiyo nadhania hata zimeanza kufanya kazi.
We attend to 10 patients a day because we have 5 machines, 5 in the morning, 5 in the afternoon.
Our population, more than 60% are poor and they are not able to access these services. So renal unit was an innovation of the county to give quality services to our people, affordable and accessible.
The school health program is so important because we get the school-going population of Nairobi, and this is a continuum of the health from the clinic to the school. What we focus in is the preventive and promotive health and minimal curative, like good hand washing, eating nutritious food, and cleaning their bodies to be in a healthy state.
Kuna wengine mabwana sao ni walevi. Wanakuja wanaanza kuwapiga. Wanakosa mahali ya kulala. Sasa mimi na wachukua wanalala, alafu kesho yake mchana ndio tunaendelea na hizo kesi ya huyo mtu.
Sometimes the survivor and the perpetrators or the relatives of the perpetrators would want the case to be withdrawn or they want it to be negotiated. We have no powers as medical people. But this one we leave it to the social and paralegal team and the children's department.
We had to come up with the sub-county networking groups. Then above that, we also formed the sub-county technical working group specifically for gender-based violence.
Appropriate health services cannot be achieved without quality data from the various health facilities or even from the community health volunteers. To this end, the county, working closely with partners, has put in place ways of quality data collection and appropriate routine data quality audits.
So what we've done is to try and bring electronic medical record systems, and we've been able to achieve that in about 33 sites, and we are scaling up to another 15. The fact that we are moving electronic will mean less data errors, also help us in defaulter tracing, because at the click of a button, you can tell who did not come for an appointment.
Celebrating achievements not only creates space for critical reviewing and monitoring progress for greater success, but also facilitates the adoption of more systematic approaches to safeguard the progress made. Much will be achieved with more resources and collaborations in place. For now, it has not been in vain. The results are a marvel.